And so you have to be cautious about overdiagnosing food allergy. It's very common. I know you've seen plenty of RAS panels that maybe you've ordered where you have 7 or 8 or 9 antigens that are showing up. And what this says is the patient is sensitized to that food, but it doesn't say they're allergic. There's more to being allergic to a food than just having IgE antibody. It involves other cells, basophils, lymphocytes, and so forth. And so when you take into account of that and you look at just not how many patients are sensitized, but how many patients actually react during a food challenge, over 50% are going to react to 2 foods or less. And then as you move further in multiple food sensitization, you see less and less having multiple food allergies. So I think that's important to consider. And it's not uncommon for somebody to have an immunocap drawn, and they come to their office and they say, we were looking for a reason for my hives or a reason for my rhinitis or something, and they told me to avoid wheat and egg and milk and see how you do. And maybe that's reasonable, but when they come to our office to put the food back in, all I do is say, well, you been eating bread? Yep. Okay, go eat bread. I mean, if they've eaten it and there's no reaction, they've already done a food challenge for you. It would be silly to bring somebody in later and say, okay, here, we're going to eat wheat in the office and make sure you're safe, when yesterday they ate a Twinkie or something else. As long as it was a full serving, they're probably okay. And so that's usually how the history can guide you. Prognosis, there's some variable data out there, but in general, by 4 years of age, about 10 to 20% will outgrow a tree nut, peanut, or shellfish allergy. 60 to 80% will outgrow your milk, egg, soy, and wheat. Factors that can increase their prognosis are an earlier diagnosis, a lower total IgE level or a specific IgE level, less severe of a reaction, and larger dose requiring a reaction. And the best way we know right now to increase their chance of outgrowing it is strict avoidance. And you can almost think of it like vaccines. When you give somebody their DTaP or whatever, you give the child the DTaP at 2 months, and you give it again at 4 months, and you give it again at 6 months, and you keep showing it to the body so they can generate this immune response and not forget it. Well, if we accidentally give this child peanut, and then a few months later he accidentally gets a little bit more, and a few months later he accidentally gets a little bit more, there's no time for immune senescence to occur. And so you keep stimulating the immune response. So strict avoidance is really the best treatment that we know now.